Common sleep disorders. Sleep disorders are a range of medical conditions that impair one's capacity to sleep well on a daily basis. Sleep disorders are on the rise in the modern world, whether they are brought on by a medical condition or too much stress. Insomnia. The persistent difficulty to fall or stay asleep despite trying to do so is what constitutes insomnia. Insomnia is considered chronic when a person has symptoms at least 3 times per week for at least 3 months. 33 to 50% of adults experience some form of insomnia symptoms, and 10 to 15% of adults are thought to have chronic insomnia. Regular exercise, light therapy, CBTI, tidying up your sleep hygiene, and sleep hypnosis are all great ways to help combat and treat insomnia. Sleep apnea. Breathing interruptions during sleep are a defining characteristic of sleep apnea. Snoring loudly is one of the most frequent symptoms of sleep apnea. This is one of the most dangerous sleeping disorders, as people are usually unaware they have it until it's too late. Despite it causing loud snoring, people have dubbed it the silent killer. Most sleep apnea falls into the following 2 categories. 1. OSA. Physical obstructions that block the upper airway are the main reason for obstructive sleep apnea, OSA. It is the most common sleep-related breathing disorder. Men, obese people, people with a lot of muscle mass, and those with genetic syndromes that affect facial structures such as cleft palate are at the most risk for having OSA. 2. Central sleep apnea. It is usually caused by the instability in the body's feedback mechanisms that control respiration. CSA can also be an indicator of Arnold-Chiari malformation. Obese people also have higher risks of developing it. When it comes to both OSA and CSA, the CPAP and BiPAP machines are the most effective treatment options. Restless leg syndrome. RLS, also known as Willis-Ekbom disease, is characterized by intense impulses to move the legs while they're at rest, as well as throbbing, itching, and other painful feelings in the legs. People with RLS are more likely to have issues with falling and staying asleep, since their symptoms are often worse while lying in bed. RLS cannot be cured, although some patients find that making lifestyle adjustments, doing light exercise, and stretching at night might help them manage their symptoms. Narcolepsy. Narcolepsy is a chronic sleep condition characterized by excessive daytime sleepiness and unexpected sleep attacks. Cataplexy, an abrupt loss of muscle tone that makes people collapse or slouch over as they fall asleep, is a common symptom of narcolepsy type 1. With narcolepsy type 2, sleep attacks also happen, but cataplexy is absent. REM sleep behavior disorder. Rapid eye movement (REM) sleep behavior disorder is when you vocalize and make abrupt, frequent, violent arm and leg movements while having vivid, often unpleasant dreams. Atonia, a transient state of muscle paralysis, is experienced by the body during typical REM sleep. During REM sleep, we see an increase in blood pressure and brain activity, uneven breathing, and rapid eye movement of the eyes. We can dream safely while lying still and having our brains active, thanks to the temporary paralysis during REM sleep. Other neurological disorders including Lewy body dementia, Parkinson's disease, or multiple system atrophy may be linked to REM sleep behavior disorder. Risk factors for REM sleep behavior disorder include being over 50 years old, male, using antidepressants or other medication, using or withdrawing from alcohol or drugs, Parkinson's disease, Lewy body dementia, or multiple system atrophy.